Well, I'm delighted now to be joined by Professor Chapple, Secretary General of the EAU. Welcome.
Thank you very much.
So, just from your position, what would you say is the real role of the EAU?
The role of the EAU is quite diverse, but essentially what we're aiming to do, as per our mission statement, is to improve the management of patients in Europe and produce a level playing field. So we provide the highest and best quality care to patients using the most up-to-date information which we know is likely to be most effective.
And tell me about some of the work that you do at a European level.
At the moment we're working very closely with all the national societies in Europe. We're also working very closely with the European Commission and with the national health authorities. Our aim is, by doing this, to provide a uniformity of care, as I've mentioned, and in order to do that we have to be aware of the very different medical structures in each country in Europe, and we need to be able to work with the regulators to affect and actually, where necessarily, influence the legislation and practice of medicine for the benefit of our patients.
And what would you say are the latest developments that most of those national societies are wanting to know about?
I think what you see at this meeting are the latest developments in the field. Now, with latest developments, obviously they're often in a whole spectrum, from new techniques in their infancy to established treatments where you've got good long-term data. And it's very important for us to actually be a showcase where colleagues can present the latest developments, the latest information, and also discuss it. Then based on that, we have our guidelines, the EAU guidelines, which are the most comprehensive and up-to-date guidelines in the world, which are updated in many cases every year, and at the very least every 2 or 3 years if there hasn't been much change. And these guidelines are based on the established evidence base, which allows people then to use them as the protocol, if you like, for training residents and for treating our patients most effectively.
And tell me about the new EuroGen reference network, just started.
Yes, we were just granted that reference network by the Commission at a meeting, in fact, only 10 days ago. And this is part of a European reference network program, and this is one which is led by the European Association of Urology, dealing with urology. It's got 3 different topics within it. One is pediatric urology, rare diseases, and of course the translation of the care of those patients into adolescence. The second is rare malignant conditions, and the third is rare functional disorders. For instance, dealing with sling erosion, where you've got damage to the urethra, and it's very topical at the moment. And indeed, it fits within our program because already we have consensus statements on these issues where we get the top experts in Europe to meet together in a multidisciplinary fashion. And the principle of this reference network is to provide multidisciplinary review of patients. So for instance, if you live in a small country where there's a population of 5 or 6 million, you may only see 5 or 6 patients a year with a condition if it's 1 per million. Then you can get the expertise of colleagues who have greater experience at reference centres in Europe. It's using an electronic, like a Skype type approach, which is a secure protocol which has been set up by the Commission. And we're going to, allied to that, be looking at what matters to patients. So we're looking at patient-reported outcome measures. We're trying to improve the management of patients using the best evidence which we have in our guidelines and in our practice from the real experts in the field.
And also the prostate cancer white paper has happened. How is that going to affect things?
I think it's very important. It's actually an initiative which we've done with the European Commission. It's been led by one of my colleagues, Hein van Poppel, who's an executive member of the EAU board, along with myself. And this paper is important because prostate cancer is a very emotive subject. It's the second biggest killer in the field of oncology amongst men, and obviously it's something that most men are worried about. So the aim of this white paper is to provide information for patients about the condition, about the treatments, to actually be able to assuage a lot of the concerns that they have if they read the popular broadsheets, for instance, or search things on the internet. So it provides a basis for a program of patient information and where we can actually set the scene.
And any other issues or initiatives that we should speak about?
Well, we've got a huge number of issues and initiatives underway at present in the association. We're a very dynamic group, and what we're doing is looking at not only the guidelines, as I've mentioned, but also looking to the future, working with the regulators, looking at devices legislation, the work time directive and mobility of doctors, very important for the treatment of patients. We're looking at working very closely with the patient organizations to see what matters to patients, so we can try and provide the best quality urological care across Europe. So that's just a snapshot of a very intensive program that we have underway at present.
Well, on that note, Professor Chapple, thank you very much.
Thank you very much.